Hello, my name is Shelley Wright. I have a disability called electromagnetic hypersensitivity, or simply EHS, which is recognized by the International Code of Diseases. I was diagnosed by Dr. Rena Bray at Women's College Hospital. When our town moved a proposed cell tower 3 kilometers away from our home, beach, school, and daycare area, this created an accessible residential area for me and my family. I'm concerned about becoming injured and displaced from a community I have lived in for 22 years. These are my questions to Town Council. Electro-hypersensitive residents experience loss of essential services and limited participation in their communities. Symptoms can become debilitating depending on the wireless signal strength, my proximity to the source, and duration of exposure. The Bioinitiative report recommends levels not exceed 10 microwatts per meter squared. However, many EHS disabled people report feeling levels lower than 10 microwatts per meter squared. My genetic test reveals biomarkers which explain my EMF sensitivity. This is my medical accommodation letter from Women's College Hospital, and this is a readable version. Hardwired technologies and airplane mode provide me with appropriate accommodations and accessibility. These are the sources of my debilitating symptoms. Symptoms linger from 8 hours to 3 days after wireless signals are absent. Innisfil residents with immune deficiencies, heart arrhythmias, Lyme disease, or MS can become sensitive to wireless signals because of a genetic or environmental predisposition. Residents who have experienced the cumulative effects of chemical or electrical exposures in the workplace, such as firefighters or hydrofield workers, may also become electrosensitive or more susceptible to cancers with additional cell towers. Residents who have experienced more significant concussions can also become hypersensitive. Children are more vulnerable, their skulls are thinner, their cells are rapidly growing, and they have a higher water content. Epidemiologist Dr. Deborah Davis expresses concerns about the effects of microwave radiation on the thinking and memory development of the fetal brain and its contribution to spikes in autism and childhood cancers. There is clear evidence of increased electrosensitivity and cluster cancers around cell towers. Electro-hypersensitive residents avoid or significantly reduce their time in community events. This can lead to social isolation from family and friends. These are the community events which aren't accessible to me. These Innisfil facilities have wireless signals that can cause debilitating symptoms. At the Elementary Teachers Federation of Ontario annual provincial meetings, 800 teachers are asked to put cell phones in airplane mode. Wireless voting is not permitted to ensure equity for wireless EHS disabled members. The Shaw Festival, community theaters, and some movie theaters have appropriate accommodations and are accessible to me and my family. At the Royal Victoria Hospital, staff are trained to provide appropriate accessibility. I'm escorted to a private elevator, disability signs are posted, patients are asked to use airplane mode, and the doctor announces his phone is left at reception or in airplane mode. This disability sign is used in hospitals, medical clinics, public places, and events. Together, we can make accessible communities. Together, we can improve accessibility for EHS disabled residents by creating appropriate accommodations for indoor and outdoor events. These Innisfil facilities are accessible to residents with EHS disabilities. They illustrate growing solutions which create greater accessibility for the environmentally sensitive. Creating an accessible outdoor community can be achieved by consulting environmentally disabled residents. Identifying their needs can reduce costly trial and error. Planning and implementing hardwired coax cables or high-speed fiber optic infrastructures for 3G, 4G, and 5G generations, minimizing cell tower installations, and encouraging multiple providers to use the same tower and aim signals away from schools and daycares would reduce wireless signals. Fiber optics to the premises is safer. It's faster with the speed of light downloads, and it's more reliable and secure for data security and privacy. Ensuring that cell towers are not installed at streetlight intersections will minimize wait times, which can be intolerable for electrosensitive people. Innisfil can promote the Alara principle and encourage facilities to use on-off switches when wireless signals are not required. Protecting parks, trails, and beaches, educating residents to foster an inclusive, hardwired community, sharing Innisfil accessibility advisory plans and timelines with EHS residents, and providing the opportunity for an electro hypersensitive resident to participate at some capacity on the Accessibility Advisory Committee and provide insight into accessible technologies for our community can improve accessibility. Our town can encourage residents to use minimal wireless signal strengths, which still maximize efficiency of devices within the home, but prevent signals from reaching the public right-of-way on each street. These actions support the Ontarians for Disabilities Act and the Accessibility Law 2025. Wireless 3G, 4G, and 5G signals from cell towers can injure sensitive residents. Small antennas are currently installed every 5 to 10 houses for 4G. The medical and scientific communities have clearly demonstrated that 4G can trigger adverse health effects. In the future, these small antennas will also emit 5G. The signals are pervasive 24/7. Your skin is the largest organ on your body, which can impact the health of multiple body systems. Wireless signals from 5G to cell towers would block the access to public right-of-way, including sidewalks and streets, therefore create a violation of civil rights and impose discriminatory barriers to accessibility for disabled residents. The increase of wireless antennas would reduce their ability to enjoy a walk down their street or participate fully in their community. Annual monitoring of wireless signals from community cell towers needs to be paid for and documented by the provider and published on our town website. Following the Alara principle and the recommended bioinitiative levels which support environmentally disabled residents need to be considered. RF levels in public facilities should not exceed bioinitiative levels of 10 microwatts per meter squared at grocery stores, hardware stores, our public library, and event centers. Global opposition against 5G proliferation is gaining momentum. People around the world are expressing concerns about the proximity of 5G cell towers and the pervasive 24/7 microwave signal exposures just outside their bedroom windows. Microwave signals interfere with the release of melatonin in your body for nighttime healing. Countries and municipalities have taken steps to stop the proliferation of 5G mini cell towers, which this step also protects electrosensitive residents. According to independent world-renowned scientists, 3G, 4G, and 5G signals have negative cumulative effects. They attack our endocrine hormonal systems, produce oxidative stress, lead to free radical production, inflammatory responses, and immune dysfunction. This plays a central role in all chronic diseases and recovery from pandemics such as COVID-19. Wireless signals attack the DNA of our cells, producing increased apoptosis, which is programmed cell death, and it can produce excessive intracellular calcium on our nervous systems, including our brain. These digitally pulsed microwave radiation signals lower male and female fertility, and peer-reviewed science clearly shows they attack the cells of our bodies, which can cause cancer. The scientist appeal cannot be taken lightly. 5G millimeter waves were used by the military to control and disperse crowds. The telecom industry and the government are required to use signal levels that follow Safety Code 6, but these levels exceed levels in other countries. Wireless signals can negatively impact all living things, all living organisms at levels well below most national and international guidelines. Neurological degenerative diseases and cancers are on the rise. 5G millimeters signals causing skin and cell stress can negatively impact a variety of body systems, as I mentioned. This can impact your short-term or long-term health. Hardwired technology is better for people, animals, and plants. Countries and municipalities have taken steps to stop the proliferation of wireless 3G, 4G, and 5G to protect their communities. They recognize that hardwired technology creates accessible communities. These are access to the premises standards. These standards reduce the signals, and these standards encourage the usage of signage. Community networks can be owned, operated, and controlled by communities. The book Reinventing Wires explains the business details for fiber optics and community networks. Dr. Timothy Shelley is willing to speak to town councillors. I also urge each member of this town council to take a look at the website connectedcommunities.ca. These are the communities who created fiber optic networks instead of wireless. Thank you for considering appropriate solutions to create accessible communities, an accessible Innisfil community that's healthier for everyone. Here's some additional information I think you will find helpful. These are wireless harm international bans, a video that is very telling of the telecom industry, and some important references if you'd like to take a look at some of the references I've used in this presentation. Thank you kindly for considering supporting electrosensitive residents in your community.
Thank you. Any questions from members of council? Comments from members of council? Councillor Waters and Councillor Ices.
Thank you, Worship. Hello, Shelley. Nice to see you again, virtually anyways. A question I have for you is that in our discussions around internet connections in the town, there's been the technology that Elon Musk is promoting, and that's his satellite technology. And I don't know enough about it to say that it's a solution. So I'll ask you, is that a solution besides hardwiring?
The Elon Musk, is it a solution as instead of fiber optics to the premises?
That's correct.
I have not explored the Elon Musk perspective so much right now. I do know that there's a radius of 5 kilometers, is what I understand, that he does a point to point, I guess. The signals will go to certain towers, and there is going to be apparently a 5-kilometer radius. So anyone within that 5 kilometers could possibly be injured or affected by that. I do know that there's fiber optics in many communities. They've applied for funding to get that to the premises to make sure that there aren't little mini towers along the street. The towers are what really creates the problem because proximity is a huge issue. Proximity and duration of exposure. So if you have many cell towers, 4G and 5G towers along the street, then that increases your proximity and affects the public right of way. So my husband just sent me a little message. I can't really read it. Oh, yes. So he just wanted to say he's an engineer, and he just said that ground-based signals are worse than satellite. So definitely the signals actually coming from the satellite are not going to be strong, but then from the stations to at the ground level, that's where the 5 kilometer radius, that's what's going to impact everyone and it will injure electrosensitive people for sure, and people with neurodegenerative diseases and those other chronic illnesses I described already.
Thank you.
Thank you, Councillor Ices.
Thank you, Worship. Actually, Councillor Waters asked the question I was going to ask, but as you were answering, Ms. Wright, I thought about the internet availability to our rural residents, where it's unlikely that they will have access to fiber optics. I'm just wondering if the effect on electro hypersensitivity is lessened when you're in rural areas where the coverage of the waves is less intense.
Yes. So electrosensitive people are affected by levels that are higher than 10 microwatts per meter squared. So in a rural area, there's more opportunities to ground. The beach area is a perfect and safe area for me to go to heal, to ground in the water, and if there aren't cell towers in that area, I have the opportunity to heal, as well as parks in this area. I can't go to some areas where there's cell towers, like Friday Harbor. They have a cell tower there, and my husband and I tried to go there, and I can't. I got very ill very quickly and didn't even notice the cell tower. So just minimizing cell towers, the installation of cell towers makes a huge difference. If those cell towers can be monitored, the levels, to make sure they don't exceed 10 microwatts per meter squared near areas where electrosensitive residents are, is very helpful. It won't cause injury. And if there are areas of our community where we can ensure that we have low EMFs, that would be great. There's a doctor who is willing to meet with town councils, who has created a book, Reinventing Wired Communities, and there's also the website that I've posted this evening. Those are solutions that are available to answer many questions that you might have around that, and accessibility and levels, and solutions to create lower EMF communities. I hope I answered your question.
Thank you.
Okay.
Thank you. Any other questions? Councillor Van Berkel?
Thank you, Your Worship. I've heard about this, but it's fairly new to me. So I was just wondering what the percentage is in the population of people that have this. I don't know whether you can answer that or not, but I'm just curious. Is there a lot of people that have it? Or?
About 5 to 8% of people are severely electrosensitive. The director of the Electrosensitive Society has more statistical information about that. I believe that people who are mildly sensitive or moderately sensitive, the percentage there is 35%. You know, there is a range of people. So some people might just experience tinnitus, or the heart arrhythmia is one of the bigger issues and problems here, because we have had fatalities in Simcoe, and we have a heart sensitive child just a street over from me. And heart arrhythmias, according to Dr. Sinatra, he is an integrated medicine individual as well as a cardiologist. He said 1 in 700 children have this sensitivity, and it can lead to heart failure. So there is a larger number of people who aren't fully aware of why they are feeling ill, and they haven't connected the dots. They have migraines every day, but they're not debilitating to the point where they're lasting 3 days like I had. And they just, you know, take the medications they need, and they just, you know, don't worry about it. But for me, it became so debilitating, and I did start to get MS symptoms. I don't have MS. And if you look at Dr. Magda Havis's website, it will show you a video will show you how wireless signals can affect people with MS and things like that. So, mhm.
Thank you, Councillor Payne.
Thank
Oh,
you.
sorry, Councillor Van Berkel. I didn't mean to interrupt. Okay, Councillor Payne. You're on mute, Councillor. Councillor Payne, you're still on mute.
I was being good and muted myself. Sorry. Is this age related for one? And how does one get tested? And I've been dealing with migraines, and I'm sort of in between health or the hydro towers or the whatever towers you want to call them. So I'm this is sort of ringing bells to me here. I'm very interested in this, and I'd just like to know how we can get tested for this.
Thank you, Councillor Payne. Yes, with any diseases or illnesses, as we age, our bodies aren't always able to tolerate toxins as much as we can when we're younger. But then younger children, they're more susceptible to this because they have rapidly growing cells. In terms of testing, there is an environmental doctor at Women's College Hospital. Her name is Dr. Rena Bray, and you are welcome to ask me questions later if you want more information about that. But there's a 2-year waiting list. And I communicate with 800 teachers annually, and a lot of them are very concerned that they can't get on the list. Was there, I don't know if I answered all your questions. Was there something else?
Councillor Payne?
A website that I can go on to get more information?
Yes. Okay. So I have a number of websites on my presentation that I added this evening.
Okay.
The Electrosensitive Society, there's the Environmental Health Trust, there's EPIC, and there's C4ST, which is Canadians for Safe Technology. So I'm happy to provide more information by email if that's helpful.
Great, thanks for that.
Thank you.
Any other questions or comments? So I guess my final comment.
I have one more. I have one more quick thing to say.
Go ahead.
Councillor Payne, yes. One essential thing to do, and Dr. Magda Havis from Trent University, who's an EMF expert and has been doing this for at least 30 years, says that if you are concerned, document your triggers when you experience this. When you feel you are exposed to triggers and your symptoms. And that's what I did to find out what I was sensitive to, because I was completely surprised that this was what was impacting me. When I documented it, it was so clear within a few hours what it was. I tried to deny that my cell phone was causing this. So documenting it, and if you can be at home and remove all the wireless sources from your home, as much as you possibly can, and see if there's a difference in how you feel, or go to a park or beach area where there are no signals for days if you can, and see if you feel different. And just, recording the differences can give that knowledge to you. You'll realize, I could be sensitive.
Okay, thank you.
Thank you, Ms.
Oh, yes, and taking measurements with RF meters. So RF meters are a scientific way of discovering what the levels are within your home. A building biologist can help you with that too. And there's the EMF Solutions website. There's many websites that can help you. Rob Messenger has an excellent website, and he's a building biologist.
Thank you.
Thank you. So we have a recommendation that the presentation regarding electro hypersensitive be received. And could I have a mover and a seconder? Councillor Payne and Councillor Waters. All those in favor? That is carried. Thank you again for being with us tonight and sharing that information, Ms. Wright.
And thank you for your questions.
Thank you.